And I'll move on to the next session. It will be regarding the 8Com, that is Attitude, Ethics and Communication in PG Examination. And I'll hand it over to Dr. Indranil Sen to take the proceeding further.
Good afternoon, everybody. Now, from a very practical sessions of instruments, I would like to draw your attention to a very so-called theoretical chapter, Attitude, Ethics and Communication in Postgraduate Examination. The most difficult part of this thing is we do not study it properly, because neither we are introduced to any textbook, neither it is a regular affair in our day-to-day practice in the hospitals and in the medical colleges to have a special focus on this part of attitude, ethics and communication. Often it is rather thought that it is taken for granted that we will have proper attitude, proper ethics, proper communication. But remember, this time according to National Medical Commission guideline, it has become mandatory at least 5% of your total marks. That means out of the 4 papers, you can expect 2 questions, 10 into 10 plus 10, 20 marks, allotted dedicatedly for these ATCOM questions. Along with that, in the practical part also, when you will be giving the practical examination, a special checklist of ATCOM will be taken into consideration, because in the practical also, dedicated marks for ATCOM is there. Now, this is not, we do not teach it formally to postgraduate till now, but now it has become almost mandatory, and well, we can't avoid it. We have to go through it. Often it is perceived that we all know all these things. We have to become very good clinicians. We have to behave properly with the patients. We have to become very polite. We have to break the news. But it is a bit sort of a, what should I say, a subjective perception. But there are certain objective points which you have to put in black and white in your answer scripts. So with this a brief introduction, let me embark upon our proper topic, the attitude, ethics and communication in PG examination. What is ATCOM? ATCOM modules, we all know, more or less we know that it is introduced to Medical Council of India, now NMC, as ATCOM, AT, and renamed in 2017 to include the ethics part of it. So in your the schedule of today, ethics in examination, it has been, it is a bit, the actual heading of this lecture is ATCOM in examination. Why it is relevant in postgraduate examination in ENT? Because beyond your clinical and surgical skills, which all our examiners will be assessing in your theoretical and practical, postgraduates must also demonstrate professionalism, effective communication, empathy and attitudes. There is no exception to it. And it should be appropriate for sensitive context, particularly pediatric group constitutes a large part of our patients. Okay? So these things are important nowadays. Now the examination scenario, there will be 2 parts, theoretical I have already told you, and there will be practical. I will be discussing only the salient points, because we have to go through the books for it, which you have not done, most of you have not done till date. Now at least devote some time for studying at least one textbook of ATCOM. Otherwise, you will find something Greek in your question paper. So professionalism and ethics, we all know that what are the topics upon which the questions will be set. In your theoretical question, theoretical paper, you may expect professionalism and ethics related questions like definition, context of medicine, key attributes, 4 pillars of medical ethics. Yes, anybody can tell me what are the 4 pillars of medical ethics? Anybody? This is important. These questions will be asked. Anybody? No? Okay. I can give you the answer, but in that case, you will only listen to me. You will not explore your books. Let it remain for your exploration. Autonomy, beneficence, non-maleficence, all these topics are there. Let you discover it. What are they? how should a doctor deal with the conflict of interest? Now, on this particular point, practical case-based scenario will be asked in your theoretical question. Discuss the ethical principles involved in end-of-life care. Particularly, we deal with a large number of malignancy cases and end-of-life situations, laryngeal malignancy, hypopharyngeal malignancy, upper GI malignancy, head neck malignancy, and therefore the life of the patients become miserable, and in many cases we can't do anything. And well, often people rather plea for euthanasia. Sir, मुझको मार दीजिए, मुझे और जीना नहीं है, इतना मैं सहन नहीं कर सकता. But in those cases, you have to give your judgment, discretion, with keeping in keeping in your mind all the points concerned in this end-of-life ethics, that is euthanasia ethics. What is informed consent? I think by this time you have all gone through this informed consent, but rather in a disorganized manner. Okay, एक तो informed consent लेना है examination के पहले, और या क्या है ना, sometimes your faculty or your teacher says that take an informed consent for this particular operation. You take it very sincerely, but you miss certain points which create problem later, because you do not know what are the information and should be broken to the should be communicated to the patient or the patient party, and how the information should be given to the patient party, and how the consent process should be recorded. That is important. Nowadays, well, a bit sarcastically I must say, all patients are potential litigators unless proved otherwise. So a postgraduate student, after passing MS, you will become consultants in different sectors. You will be specialists. So you have to face this part, medico-legal aspect of the problem. Second thing is doctor-patient relationship. Elements of the ideal doctor-patient relationship. These are the topics upon which the theoretical questions can be there. Importance of empathy, consequences of poor communication in the doctor-patient relationship. This may be a problem-based question, PBQ, in your theoretical question. A situation will be given. Please identify the deficiency in communication skills of doctor-patient relationship here, and where the breach of contract was broken, and how, what will be the consequences, medico-legal consequences of such event. How does confidentiality affect trust in the doctor-patient relationship? This question can jolly well be there in your theoretical question, theoretical paper. Now the communication skill. What are the components of an effective communication skill? You speak a lot of things to your patients regarding the operation, regarding the outcome. You counsel the patient that this operation is going to be undertaken upon you, and these are the consequences, these are the morbidities, these are the outcome, these are the possibilities, this is the protocol which we are going to follow, etc., etc., etc. But is that communication sufficient, effective, and adequate from the point of view of this charted points? In many cases you miss major points because you don't study it systematically in most of the cases. The fault also lies with us. We also do not emphasize upon this part of the curriculum in that way. So how do you break bad news to a patient or relative? Outline the Spikes protocol. Yes, anybody can tell about the Spikes protocol? What is Spikes protocol? You are PGTs. The day after tomorrow you are going to appear. Yes, Spikes protocol. Yes, give him a mic, please.
It is a protocol to breaking bad news.
Very good. The Spikes is an acronym. Can you say that? Spikes protocol. Okay, sit down. I will discuss. Okay. Describe barriers to communication in healthcare and how to overcome them. Write a short note on patient-centric communication. These are the topics upon which you can expect questions in your theory paper. Now, this is the Spikes protocol. Setting up the interview, perception, invitation, knowledge, empathy, strategy, and summary. This is the Spikes protocol. This can be a long question in your theory. What is the Spikes protocol and how are you going to break a particular situation news to a patient? So this is Spikes. Setting up the interview, ensure privacy, significant others, the sit down, establish connection, access the patient's understanding, and nowadays things are becoming very much important, that you follow everything in a formatted manner. Just as an example, suppose you are a malignant tumor, you are dealing with a case of malignant tumor, carcinoma larynx. How are you going to break the bad news or the information? That what are the possibilities of this particular tumor, what you can do next. Suppose there is a lung metastasis from a carcinoma larynx. How are you going to do that? First setting, private room, family present, sits down. What have you understand of the test so far? Biopsy shows a malignant tumor. You have to explain it to the patient party and the patient. How are you going to do that according to Spike's protocol? This may be a long question. You can expect this long question, similar long questions in your theory paper. And then you have to say, follow the Spike's protocol and give your answers accordingly. Now the theoretical, next part is the cultural competence and the social determinants. What is the cultural competence? Why it is essential for patient care? Because the patients are not uniform. A patient coming from the urban part of the society, a highly educated patient having a particular disease, carcinoma larynx stage 3, and another patient who is coming from a slum, education level is standard 4, are you going to discuss and give the information in the same way, same manner? No. Culture, and whether they are going to accept it with in a uniform way? No. So cultural competence and social determinants, these factors are important in patient communication. Now these questions can be, how do social and cultural factors influence health and healthcare delivery, and discuss the ethical issues arising out of patient's cultural beliefs which contradict medical advice. Suppose you have advice to not to do something. Patient says, no, I can't do that. Just for an example, you have asked the patient not to take some particular type of food for a particular reason, or you have advised the reverse. You have to take this. Suppose very simple situation in our society. Suppose the patient is having a severe protein energy malnutrition. In a carcinoma patient, carcinoma larynx or carcinoma esophagus, you want to increase the protein intake, animal protein. Patient says, I am a strict vegetarian, I can't take anything. That is an ethical issue also. Okay. Theoretical, legal and ethical responsibilities, medical negligence, what constitutes a medical negligence, legal and ethical implications, legal provisions of patient autonomy in India, Code of Ethics, Medical Council of India, role of documentation in medical practice. Theory questions can be there. Medical humanities and history of the different subjects, history of medicine can be a part. How does the study of medical humanities discuss the evolution of the ethical thought in medicine? That means you have to start with the Tuskegee event, the Nuremberg Code, Tuskegee event, then you have to gradually to the Helsinki Declaration, then starting from the say the Hammurabi Code and the Hippocratic values, and down to the current state of medical ethics, which is recommended by WHO, which is slightly modified in India by ICMR Code of Ethics. Write a brief note on historical events shaped current ethical. I'm just now we discussed that what is the Tuskegee event, what is the Helsinki Declaration, how did it come, what is the Nuremberg Code, why did it occur, all these things will come as a long question. Now, last but not the least, teamwork and the leadership in healthcare. Characteristics of effective healthcare. Suppose the day after tomorrow you will going to lead a healthcare system as an expert and specialist. How are you going to do with your teamwork? What should be the interpersonal communication? How will you discuss about something, rather negative feedback, how to give a negative feedback to your colleague? How to give a proper feedback to your colleague regarding a particular patient. Suppose it's a junior, that undergraduate is posted under you. Suppose that student has done a mistake. How are you going to give a feedback to him or her so that he should rectify himself? So in this way, questions can crop up. And last is not the least, reflection and the self-awareness, reflective practice, clinical experience. How can doctors cultivate lifelong learning and ethical awareness? Now coming to the tips of answering these questions. Use ethical principles, autonomy, beneficence, non-beneficence, and justice. Whenever you are going to answer, keep in mind these particular points. Real life or clinical examples, you can cite it. Reflect on personal or observed clinical experiences. Be empathetic and respectful in tone. And remember, during your practical examination in the first part, when you will be clinically examining the patient, the ATCOM part will become taken into consideration, and here is the checklist. Probably all the examiners who is going to observe you for the ATCOM part is going to have the checklist in their hand. So in the practical ENT, other than OSCE, may not be an OSCE, Even in during your clinical examination, when you are examining the long case or short case, one of the examiners will be standing beside you and taking points, the checklist of your ATCOM things. So these are the checklist. There are at most 17, something like that, 17 points in the checklist. I will be sharing this PPT with you in your group. Ajay, there's a provision to share this PPT in the group? Okay. I will be sharing all these points, with you. So I will not elaborate. I'm not going very rapidly. So your OSCE is, these are the 17 checkpoints. This is an examination, the scenario example. Example, a grommet insertion for otitis media effusion in a child. So these are the points. Introduce yourself, describe procedure, empathy, non-verbal support, summarizing and follow-up. This reflects the ATCOM checklist. Professional introduction, eye contact, rapport, verbal, non-verbal communication, explanation in chunks and comprehensive checks, and consent process summary and closure. In PGENT, what should you prepare? The important part of the story. Know the structure, introduction, building rapport, and ensuring comfort. Use a proper terminology and language. Explain ENT procedures. Be empathetic, check comprehension, handle clinical situation, and then you have to close the session. Tips to excel, practice template dialogues. Use peer role play, feedback, and review ATCOM modules. Final takeaway in your PGENT examination, ATCOM isn't only theoretical, it's also assessed through OSCEs or during your practical examination, where your communication, empathy, clarity, and ethical reasoning are scored. Score থাকবে পরীক্ষার্কে কিন্তু dedicated 20 marks theory-তে এবং practically accordingly 5% of the practical কিন্তু ATCOM-এ থাকবে. So keep it in mind. Here are the references. অনেকগুলো আছে, আমি জানি এই সময় তোমরা সব বই আর পড়তে পারবে না, আমি 4টে রেড লাইন দিয়ে মার্ক করে দিয়েছি। এর মধ্যে হচ্ছে 1 নম্বর এনএমসির যে ATCOM মডিউলটা ইউ মাস্ট সি, দ্য মেডিকেল এথিক্স ম্যানুয়াল WMA, যদি সম্ভব হয় এই বিউচ্যাম্পের বইটা একটু দেখতে পারো, the medical ethics, and number 4 NB guidelines on ethics and professionalism for the residents. So in short, আমি জানি পড়তে এগুলো কখনোই পড়োনি, বাকি যে কটা দিন আছে পারলে এর মধ্যে যে কটা পারো অ্যাটলিস্ট এনএমসি গাইডলাইনটা ATCOM মডিউলটা দেখে নিও, এবং তার সঙ্গে যে ওই ওয়ার্ল্ড মেডিকেল অ্যাসোসিয়েশনের যে এথিক্যাল গাইডলাইনটা আছে, ইউ শুড গো থ্রু ইট। থ্যাংক ইউ ভেরি মাচ and best of performance for all of you. I think I am in time.
If there is no questions for the session, then we can proceed to the lunch.